Musculoskeletal screening. The aim of this video is to introduce students to the basic principles of musculoskeletal system examination. The objectives are: students should be able to perform generic joint examinations using the principles of look, feel, and move. Students should perform Gell's screening examination and understand its rationale. And students should be able to demonstrate an understanding of range of motion of joints. With the exception of lumbar spine flexion, range of movement of joints is generally measured in angles. The angles are determined in multiples of 15 degrees. For example, in this picture, the elbow is fully extended and has 0 degrees of flexion. 90 degrees of flexion is perpendicular to the starting point. In this picture, the angle of flexion is determined by dividing the second 90 degrees into 3. Based on this, the estimated flexion achieved is 90 degrees plus 30 degrees, which equals 120 degrees. Use this principle to estimate the flexion angle of the right knee in the following pictures. Gell's screening. G is for gait. Ask the patient to walk a certain distance, stop, turn around and walk back. During the gait observation, look for the stance and swing phases of a gait cycle, position of the shoulders, whether they sway to the side or dropping on one side, comment on pelvic tilt and movement if visible, look for abnormal knee movements, such as thrust or giving way, look at the foot position on stance phase, and finally, look if the stance and swing phases of each limb are equal. A short stance phase indicates an antalgic gait. A is for arms. Inspect both upper limbs. Adequate exposure is mandatory. Inspect the dorsum of the hands, then supinate them and inspect the palmar side. Comment on skin changes, scars, deformities, attitude of the fingers, muscle bulk, nails, and any asymmetry between both hands. Check the power grip by asking the patient to grab your index and middle finger as tightly as possible. Assess the pinch grip by asking the patient to pick up a small object using the thumb and index finger. Observing from the front, extend, then flex both elbows, looking for the smoothness of range of motion. Look for varus or valgus deformities and comment on the carrying angle. Ask the patient to abduct both shoulders in a smooth arc until their palms touch above their head. Comment on any abnormalities in the arc and range. Ask the patient to flex the shoulders. Finally, ask the patient to put their hands behind their head. L is for legs. Inspect and describe the lower limbs, looking for scars, wounds, muscle bulk, alignment, and joint swellings. This can be done with the patient reclined. Also inspect the toes and the soles of the feet. The patellar tap is performed by compressing the suprapatellar bursa with one hand. The other hand pushes the patella downwards. The sign is positive if you can feel the patella sink and taps on the underlying femur. To perform the fluid shift, Use your hand to massage any fluid in the anteromedial compartment of the knee into the suprapatellar pouch. Next, stroke the lateral side of the knee and the suprapatellar pouch to push any fluid back into the anteromedial compartment. Test the hip joint for internal rotation. This is done by flexing the hip joint passively to 90 degrees. Internally rotate the hip and document the range of motion. Compare to the contralateral side. S is for spine. Assess the spinal posture from the front, side, and behind. Inspect from the back for scoliosis. Inspect from the side for kyphosis and lordosis. Proceed to ask the patient to touch their toes. Inspecting from the front, assess the lateral flexion of the cervical spine by asking the patient to touch his ear to his shoulder and observe the smoothness of the range of motion. GALS covers only the basic movements of the musculoskeletal system. If an abnormality is identified, then that joint requires a detailed examination.